September 6, 2019, the 95-year-old former president of Zimbabwe, Robert Mugabe, died of cancer. He did not, however, die in Zimbabwe. Instead, Mugabe chose to receive his medical care, as he always did, in Singapore, a whole 5,000 miles or 8,000 kilometers away. Each of his many such trips required no fewer than 10 hours in the air each way, by which time he could have flown anywhere in continental Europe. The African revolutionary was not the only powerful person to seek treatment in this Southeast Asian city-state of just 5 million. So too did the daughter of the Philippines president, the president of Bangladesh, several military leaders of Myanmar, and the former First Lady of Indonesia, to name just a few examples. Heads of state no doubt appreciate Singapore's tight control of the press and lack of protesters, though their first priority is surely the same as its other 500,000 annual medical tourists: to receive what is perhaps the best healthcare on Earth. Today, the average Singaporean lives to be an astonishing 83 years old, a full decade longer than the world average, and only slightly behind Switzerland, Macau, Japan, Hong Kong, and San Marino. Another common metric for healthcare quality is the infant mortality rate, at which Singapore is among the best in the world, just 2.1 for every 1,000 live births. Finally, Bloomberg ranked the country second in overall efficiency. These are impressive outcomes on their own, but they become downright amazing when you consider how little they cost. The United States spends about 17% of its GDP on healthcare, making it an embarrassing outlier even among the most developed nations. The UK, a more representative example, stands at 10%, Australia 9%, and Israel just 8%. Singapore, on the other hand, spends just 4% of GDP. This is, in fact, lower than the minimum recommended by the World Health Organization. On this metric, Singapore is surrounded by poor countries like Sudan, Eritrea, and Madagascar. If you didn't know of its world-class outcomes, you'd assume, based on this number, that it must surely be a struggling backwater, not a thriving global finance hub. If the US spent the same proportion of its GDP on healthcare, it could afford, with those savings, to permanently finance 139 of the world's smallest countries. It could save 3 times the entire cost of the American military. Somehow, Singapore provides the same or even better healthcare than the richest countries in the world, at the cost of the poorest countries in the world. In designing healthcare systems, governments willfully choose at most 2 of the following: price, quality, or equal access. They do so because they accept these natural trade-offs, believing that you can't have it all. Singapore, on the other hand, seems to have solved this M.C. Escher-level puzzle and delivered